again, I think over 2 years, we have now learned this, that hoarding everybody in is not really the solution. It had its own effect or benefit in the beginning when we didn't have these armors with us. Now we have vaccination, we have other things. As you said, we have protocols to treat. So we are much in a better space right now. But to pregnant women, I'll have one statement to say. Don't be at some place where you don't need to be. Okay? So if you need to go to somebody to meet and you think it's essential, go ahead. We are not doing a house arrest for you, or we don't expect you to be staying at home. But if you think I can do without going to the mall, then maybe you could. So use your judgment and your common sense and protect yourself. So we don't recommend that you should be sitting at home, because you have to come out. You'll have to probably come out for your checkups. You have to come to hospital to see doctors. You have to come to get a scan done. So you please remain and do those activities which will keep you mentally sane is also important.
Yes.
Because depression, anxiety is at the peak in women, and especially when you're pregnant, you have double anxiety. So we don't want you to become mentally unwell as well. But double masking, avoiding indoors, big parties or big gatherings is something you should watch out for. And in travel, there is another one caution which I use myself, and I'll tell all of you, is that even if you have masked well, wearing a shield will protect you. So a face shield additional can help you, especially with this very infectious virus, the Omicron strain, because you can never say whether the person next to you is infected or not. Because try to understand now, two dynamics have changed. One, because a lot of adult population in our country are vaccinated, they may have an infection but may not have so much symptoms.
So they may
as you said. Yeah, so they may be an asymptomatic carrier, but they can pass on to you. So that's very important. The second is that the most infectious period is about 1 or 2 days before you develop the symptoms. So you may be taking a plane ride with somebody who probably will develop symptoms after they reach home, but they were infective at the time. So we need to protect ourselves. So, and many times others may not wear the mask so well. We can tell them, we can request them, but we can do for ourselves. So remember that.